Good morning, I am Jomar V. Sayaman, and today I will be showing to you my teaching demonstration. The subject is abnormal psychology and the topic will be about the current issues. So good morning class. Okay, may I request everyone to kindly stand up. So we will begin with a short prayer. Okay, you may now take your seats. Okay, so I will just check your attendance. Juan de la Cruz. Okay, so no one is absent. Okay, very good. So before we proceed with our discussion for today, let us have a brief recap. What do you remember about our past discussions? Jessica. Okay, so we discussed about normal and abnormal behavior. We also discussed about how can we identify whether a behavior is normal or abnormal. Okay, in terms of abnormal behavior, there are what we call the 4Ds. So, what are the 4Ds? Makoy. Okay, very good. So, those are distress, deviance, dysfunction, and dangerousness. And also, we discussed about... Okay, very good. So, we discussed about the different anxiety disorders like generalized anxiety. So, what do you think are the manifestations of generalized anxiety disorder? Okay, very good. Very good, Christian. So, in this pandemic, it is really relevant and it is very timely that we should focus on taking our physical health, right? However, it is also as important as physical health that we should take care of our mental health. Especially in these times of COVID-19 pandemic, that everyone is struggling with their everyday lives. Okay. Okay, so there are actually two common causes or effects, effects of this situation to our mental health. And it includes stress. But what do we mean by stress? Okay, we mean by stress as what? Okay, when we say stress, it is actually our body's way of responding to any kind of demand or threat. Okay, so it is our body's way of responding to any threat or demands. For example, we feel angry, we feel so frustrated, irritable, and it's because of this situation. Or maybe we are bombarded by a lot of problems. Okay. So, and also, stress cannot just be negative, but it can also be positive. For example, this pandemic have given us opportunity to practice new skills. For example, we learn to be more productive. We learn skills such as urban gardening. In that case, it is a positive effect. Stress is positively affecting our lives. And also, stress is not just coming from our direct experiences with our environment or our negative life events, but also it can be coming from other stresses. For example, your family member, your friends, or someone you do know, or someone who's near in your neighborhood. Okay, it can also affect you. That may increase your stress level. And in terms of duration, there are two types of stress. The first one is acute stress. Acute stress is kind of short-term. Meaning, once you experience the stress, it will go away too quickly. Okay, for example, let us use the experience of Nicole and Angel Locsin and Jericho Rosales in The Legal Wife. What do they experience when they are having an argument with each other, and then after their argument, the stress will go away too quickly? However, there is what we call the chronic stress, which is the second type of stress, which is a kind of long-term, meaning it will not go away too quickly. Okay? So, for example, we know that in The Legal Wife, there's this character named Nicole, portrayed by Maja Salvador. Okay, she is the mistress of Adrian or Jericho Rosales. Okay, she has been the cause of stress of Angel Locsin for a longer period of time, maybe for more than a year. Okay, so that's an example of chronic stress. Okay, another effect of COVID-19 pandemic on our mental health is what we call the anxiety. But what is anxiety? Anxiety is just a body's natural response to stress. Okay, we feel that fear. We have these feelings of apprehension of what are we going to do? What will happen into our lives when since we are encountering so much problems because of this COVID pandemic. But before the lockdown starts, we are also experiencing fear, such as when we encountered snakes into the forest. Okay, when we encountered snakes into the forest, we are afraid that this snake will attack us. And that feeling is what we call the anxiety. And in this time, we are experiencing so much anxiety because we are afraid of getting infected by the COVID-19 virus. Okay, so that is, those are just possible, or those are just common effects of COVID-19 pandemic, which is normal, that all of us might experience. However, there are people who fail to cope with it or overcome those problems. And in that time, it causes them to experience anxiety disorder, such as generalized anxiety disorder, and also depression, suicidal behavior, and even alcohol and drug use. Okay, so this is our discussion for today. I hope that you were able to learn. Is there any clarifications or questions that you would like to ask? Okay, none. Okay, so I will group the class into 4, and each group will receive case vignettes or case studies about the different experiences of individuals. But I have to take note, or I have to tell you that these are just hypothetical scenario. It doesn't reflect any experiences of individuals. Okay, so what you're going to do is to study the case and then review what we have discussed today. And then you will present it in class after 10 to 15 minutes. Okay, meaning you will be given 15 minutes to work on it, and then each group will have the time to present. Okay, you may now start. Okay, 5 minutes left. Okay, time's up. Okay, so group 1 will be the first one to present their discussion or their answers. Okay, so to the first group, may I know? Okay, that's correct that that your answer is that behavior is really abnormal behavior. But what makes you think that it is normal? I mean abnormal. Okay, very good. Okay, the second presenter. The third And then the fourth one. Okay, I am very amazed that you were able to answer it correctly. And I am very pleased that you all participated in this class. Okay, so I will give you an assignment. This is a reflection paper. I want you to identify and explain your experiences during this situation. And I want you to be more aware of your feelings, whether it is negative or positive. And then, you can also write what are the possible factors that makes you feel, that causes you to feel this way. And also, how do you overcome, or what coping strategies do you use? Is there any more questions? Clarifications? Okay, none. So, thank you for participating, and see you next meeting.